After a tummy tuck, drains will be placed. Depending on whether you have a mini, standard, extended, or belt tummy tuck, it may vary from 1 to 4 drains. These drains will stay in place until they are draining less than 25 cc's in a 24-hour period for 3 days in a row. Some drains may slow down and are ready to be removed before others. Typically, for most people, they will remain in for 1 to 2 weeks. However, there are times that they may be required to stay in for a longer period of time. It is very common for the area where the drains enter the body to become red and irritated, and at times may even have some discharge from the area. You will be placed on antibiotics and will want to continue until all drains are removed to help prevent infection during this time. It is important for you to keep track of how much fluid you're getting out of the bulb. To do this, you first want to unclip it from your body. Then what we're going to do is take the cap off the top of the bulb. It will fill up with air. At this point, you can read on the bulb how much fluid you have in there. Once you've recorded and read how much fluid is in there, you can empty it into a container, and then what you're going to do to close it is to compress the bulb and put the cap back on. That way it creates suction from the body when it's deflated. Each time you empty the drain, you want to strip the tubing. To do this, what you're going to do is hold the tubing close to your body tightly so you don't pull it out. And then what we're going to do is use an alcohol wipe to strip the tubing. With your other hand, you're going to grab onto the tube and squeeze and pull in the direction of the bulb. You want to be pretty aggressive. Don't worry, you won't break the tubing. This helps remove any clogging or particles that might accumulate in your tube. This can be done more often if needed if you feel like your drain isn't draining any fluid into the bulb or you feel like it's clogged. It is common to get some white fatty tissue or floaters in the bulb or tubing. The color of the fluid will change. It starts as a red color and then changes to more of a pink and eventually a yellowish straw-colored liquid. When the output of the drain slows down, it is important to empty the bulb 1 time a day, at the same time every day, so that you can get an adequate reading. Remember, they will be ready to come out when there is less than 25 cc's in a 24-hour period of time for 3 straight days in a row. It is hard to read anything less than 25 cc's. That is why it is important to leave it in for the full 24 hours before emptying when you are not getting much drainage. Please call the office and make an appointment to have them removed at that time. Drains are never fun, and most people are ready to get rid of them as soon as possible. However, we want to make sure that you are ready. If we take them out too early, then that fluid will build up and accumulate inside. If this happens, it has to be drained out with a needle. We will want to see you back in 1 week after your drain is